Good afternoon to every one of you. I hope that you are able to hear me clearly, and good to see some of you. Familiar names, though I may not be able to see your face. Let me begin by sharing the screen. Okay, all right. Today we're going to talk about post-COVID care. And it's usually my custom to pray before we begin. So I'd like to invite you to join me. Father in heaven, be with me as I share, that I'll be able to give a clear message in Jesus' name. Amen. All right. So when we talk about COVID care, post-COVID care, we recognize the fact that this virus is what we call SARS-CoV-2 virus. And they call it COVID-19 because this is the pathogen that was responsible for this COVID pandemic that you're having at the present moment. And it belongs to the coronavirus group. You probably have seen some photos of it. It's like a halo with many spikes coming out. And there are many different types of variant that is present. So the WHO has classified them as variant of concern. That is, some of them are the alpha, the beta, the delta, and the gamma. And there's another category that is called the variant of interest, which is the eta and the kappa. So in Malaysia, at the present moment, the one that is dominant is the delta variant. And each of these different type of variant, their infectivity and the time of onset of symptoms actually varies. So we recognize that the present one, that is the Delta variant, is more infectious than the normal one that was before. So when we talk about COVID-19 infection, people presenting with different signs and symptoms, they are actually classified into mild and severe. So there is 5 stages or 5 categories. The first one is category 1, where the person who has contacted the virus is asymptomatic. Asymptomatic means that they do not succumb to the complication of it. They may have a little bit of low-grade fever, aches and pains here, or sometimes some people may not even know that they have been exposed to the virus. Category 2 are those that are symptomatic with no pneumonia. All right, pneumonia means lung inflammation, lung infection. And category 3 are those that are symptomatic with pneumonia. Then there is the severe group of people. They have symptomatic, they have pneumonia, and they actually require oxygen. And number 5 are those that are critically ill. They have multi-organ involvement. So there's a liver problem, there's a heart problem, there's a kidney problem, and there is a brain problem. So this category 4 and 5 are the ones that's more severe. So when we look at post-COVID infection, we look at this graph here. It tells us that when we are exposed to the SARS-CoV-2 virus, right, a person may start to have what we call a PCR test positive, right, after being infected. And when you do the PCR test, is also very important. If you do the PCR test earlier, then when the virus has not multiplied to a very high load, the viral count is not very high, your PCR test may be negative. So that's why you find that some places require it to be done twice. So when we look at this graph, what we want to concentrate more is this part here, all right, where we find that when we define post-COVID, right, we are saying that it is about from week 4 onwards, all right? So from week 4 onwards to week 12, after being symptomatic, we call it subacute or ongoing COVID-19. After 12 weeks to about 6 months, we call it chronic COVID-19 or post-COVID-19, okay? So let me put it in words, help us to understand what we saw in the graph just now. When we talk about the terms as used for the chronology of COVID infection, we are saying that acute COVID-19 signs and symptoms last up to about 4 weeks. Can you see that from week 1 up to week 4? So this is the acute COVID-19 phase. For some people, it may be longer. It depends on whether a person is immunocompromised or not. So when we talk about long COVID, right, we are dividing it into 2 categories as you saw just now. Category number 1 is from week 4 to week 12. Category number 2 is from week 12 to 6 months or more. So what we want to dwell on today is not so much of this acute one, because most of the time during this period here, people may be hospitalized or in the ICU or whatever. But what we want to concentrate, especially in this talk, is this period of time here and what we can do about it, all right? So we are talking about the ongoing symptomatic, or we call it subacute, or the post and chronic COVID-19, all right? So when we look at the symptoms of long COVID, remember we said that long COVID is falling into these 2 categories. So when we talk about long COVID, we can see that the viral complication can affect many different systems. I will not go through reading all the systems, but we will look at some of the common ones, right? And we will talk about some of the common ones and what we can actually do during this post-COVID care period, right? Addressing the symptoms and the signs that we may be having. So this is another picture to categorize the different systems and what are some of the symptoms and also the signs that may appear in the person that has had a COVID infection. Now, this statistic is taken in Malaysia, and you find that this graph pie chart that you see here and this bar chart that you see here is actually to tell us the various symptoms that you have seen earlier on this picture here. And you can see that of all the symptoms, the one that continues on between the 4th to the 12th week, the highest is fatigue, tiredness, all right? Then there is exertional dyspnea, there's insomnia, not able to sleep, there's anxiety, and there's cough. All the other symptoms that you can see out there are actually quite minor. Not many people have all these symptoms continued for the 4th to the 12th week. But as you look at the next slide, these are for people that have the symptoms more than 12 weeks and sometimes even up to 6 months. And you can see again that it falls under the same category, right? Some people have additional, that is pain. So because of this, we want to address the commoner ones, all right? So here we find that we want to talk about some of the commoner ones, and we are not going to talk out of the topic because COVID care is a very broad topic. So when in this discussion, right, during this period of time, we are only talking about adult COVID-19 patients. Okay, so post-COVID care for adult COVID-19 patients. The post-COVID care for children COVID-19 patients will be a bit different. We are not going to talk about the acute COVID-19 care, that is to say the first 4 weeks. So we're not talking about what should I do when I have a COVID infection, right? That is another topic altogether. We are not discussing on subacute nor chronic COVID-19 syndromes for those in category 4 and 5. That means to say that the severe ones. So we're only talking about those people that had COVID infection, but they fall into category 1 to 3, right? 1 is asymptomatic, 2 is they have symptoms but no pneumonia. 3 is those who have symptoms but with pneumonia. All right, so not category 4 or 5. And we are not talking about COVID care for those who are immunocompromised, meaning to say that those who have autoimmune diseases or those who have cancer and caught COVID, or those people who are pregnant and had COVID, because it's part of the topic. What we are going to concentrate on is number 5 here. We are going to concentrate on home self-management for those who are going through rehabilitation for category 1 to 3. And we are specifically talking about how to manage some of the common symptoms and signs. Remember, we said that the symptoms and signs that are common are the one that has a star here or the cross mark here. Okay, so we're going to go talk about this because there's too many other things to talk about in this limited time. So we will confine ourselves to just those specific common signs and symptoms. And we are going to talk about some of the self-assessment that you can actually do in your home setting, right? Not in hospital setting. So with this in mind, we want to say that once you are discharged from the hospital, there are some general guidelines that you need to take care of or we need to follow, so-called the SOP, right? So when at home, we need to avoid or minimize close proximity with others, right? So here, this is very important. We are not saying that you cannot pass the virus to someone else. It all depends on how many days you have been admitted to the hospital, right? So you need to practice the SOP so that you will not infect some other family members, even when you are home quarantined, right? Suspected or to have COVID-19, or sometimes even have the PCR test that's positive, but there's not enough space in the hospital to quarantine you, so you're home quarantine, so you need to be a bit careful, right? So after you come back from the hospital, like I said earlier, depends on how many days you have stayed in the hospital. You may not be infectious. It all depends on whether your PCR test is positive or not. We need to wear masks as far as possible, and remember to wash your hands frequently and try to stay away from gatherings, all right? Especially, you will find that this is the area in which many people let their guards down. So you may be wearing a mask at all times, but when you come to makan time, you tend to take out your mask, and most of the time, it is at these gatherings that you're so free, carefree in a certain sense, that you let down your guards, and that's where you find that your virus can actually spread from one to the other, especially if you have visitors from other places coming to your home for the gathering. And the other general guidelines: avoid alcohol, tobacco, and caffeine, because this will not be very helpful to you, right, when you are having a post-COVID time, as it is pro-inflammatory. Now remember that COVID-19 infection is more than just a viral infection, right? It is a virus causing a lot of inflammation. And because of a lot of inflammation, that's why you'll find that some people may have the complication of COVID infection that may last up to even 6 months, like we mentioned just now. Now, what we want to do now is to see what we can actually help in a home setting with regards to some of the symptoms we may be having. So I would like to give this talk in a very systematic order. First of all, we will discuss about the generalized symptoms and specifically fatigue and sleep disturbances. So if you have been discharged from the hospital and you have gone back home, right, and you're feeling tired and you're not able to sleep, what can you actually do? There are a few things that you can actually do. First of all, we need to have a rough objective assessment of your fatigue scale, all right? So this is a visual analog fatigue scale. So it's a very easy scale here. From a score of 0 to 10, as you look at this scale, what do you think describes your global fatigue? In other words, do you feel that your fatigue is at a scale of 4 out of 10, or is it 9 out of 10? So if you have a fatigue scale of 9 out of 10, that means to say that you are really, really very tired and you really do not have much energy. And as the days and weeks go by, your fatigue scale should actually go down. You should actually improve. So what you need to do will depend on at which level of fatigue scale you are. So if you are at the level of 9, then you probably need to take things easier. If you are at the level of 3, then probably you can do more activity, as we will talk about afterwards. So it is more like an objective way to help you to evaluate how much you are actually progressing with the weeks after the COVID infection. So what can I do, right, if I feel tired, if I have fatigue? Number one is rest. Now, this rest is more important than just sleep, all right? A lot of times when you're at home, people may not actually be resting, right? Even though you may be lying on the bed the whole day, but yet you may be involved in TVs and phones and social media, checking your WhatsApp, right? All this actually does not give you rest. So when we say rest, it is rest of body and also rest of mind. Rest from the telephones, the social media, the WhatsApp, the Telegram, the Facebook, posting all pictures and so on. And during this period of time, there need to be practicing of breathing exercises, which we'll talk about later, and even spiritual meditation. Some people may need the help of some essential oils. Lavender is good as a calming effect. Some people may need relaxing music. So basically, one of the things to do is that when you are tired, just rest, all right? Now, insomnia is one of the challenges that people face, and how to go about solving this. Because of the short time, we do not have a lot of time to talk about this, but I've actually talked about it under this Facebook page. So if you can take a snapshot of this screen in your own phone or computer, then you can go to this Facebook web page and you can hear an hour talk about sleep and what you can actually do, right, to help you to have better sleep. The other thing to help in a person who has fatigue is to have the appropriate nourishment. So maintain normal routine for eating, right? Habits of timing is very important because when you're fatigued, you find that your whole cycle is in a haphazard manner. So try as far as possible to maintain a routine. Remain hydrated, that's very important, with normal frequency and volume of urine. Right? So if you find that you're drinking a lot, but you're not passing urine, then you need to suspect whether your kidney is playing up or not. All right. Now, in terms of nourishment, as probably some of you have heard Candy talk about the diet for this pandemic time, we would like to take food that is rich in phytochemicals and antioxidants. So whole food that are wholesome. So we call it whole food, unrefined, right? And limit the amount of salt, the sugar, the fat, and avoid alcohol and caffeine, right? Because alcohol and caffeine, like I said, is pro-inflammatory. And especially if you have COVID complication involving your heart, then you find that this caffeinated drinks is actually not the best for you. Right? Now, when you come to activity level, when you're fatigued, when you're tired, then your ability to move around will actually be less. So what we need to do is we need to think of activities that use low energy. And don't be afraid of the fact that you cannot do what you used to do before, right? But with time, by setting small goals, and progressively increasing your activity level gradually, you should be able to achieve what you probably had energy that you had before. So don't rush yourself, right, into so-called fitting yourself to be able to be like what you were before the infection. So here, when we talk about activity, we need to prioritize our activities. And very important is to set the limit. So in other words, in each day, you need to have a goal, right? And try to have what we call SMART goal. It must be specific, it is achievable, you have a time frame for it, right? And so on, right? Some of you know what is SMART, okay? And many times we may need to modify how we perform our daily activities, all right? So if you are used to standing up when you're grooming, now after the infection, you are fatigued, you feel tired, you may need to sit on a chair during your grooming session. Or when you're cooking, you might need to use a lighter pan rather than a heavy pan when you're cooking. So try to see how you can modify your daily activities so that you do not need to spend so much energy to do the things that you want to do as before. So mental well-being is very important. Stress and anxiety can drain the energy. So don't rush yourself. Don't be too carried with too many things that you have to perform. And don't rush yourself to want to get well in such a short time, because anxiety and stress can drain your energy level. So when you return back to work, all right, when you're fit to return back to work, try to use simplified techniques, right? For example, if you are in a workplace, you need to prepare and plan what you want to do for the day. And as far as possible, if you need to move here and there, then you may need to minimize your hand and body motion during the activity. So what can you do? Put whatever that you need for your work in a particular table or places near to your work desk, so that you do not need to walk here and there to get a piece of paper or to get a ruler or to get something, right? You might need to change the way you do things, how the tool has been used before, right? So some people have used, if you have a problem with muscle weakness of your hands, then maybe, and your grip strength is less, then maybe by, instead of holding a spoon, you may need to put a spoon into something bigger so that you can grab better. Or you may need to have a long tongue to be able to help you to take things so that you don't have to move here and there. So these are all the things that you might need to think of, right? Modify the techniques that you need to do in your workplace so that it will help you to save your energy. The next part we want to talk about is the respiratory system, right? And under it, we have how to deal with breathlessness and cough, okay? So when we are talking about cough and exertional breathlessness, it's important for us to recognize that the lung actually has gone through an inflammation, okay, especially for those who have pneumonia, and it takes time to recover. So that's why you have breathlessness. And due to the irritation that is present post-COVID, there is this cough reflex that can actually be exaggerated. Sometimes you may be coughing a lot, but there may not be much phlegm coming out. And we will see what are some of the breathing techniques and exercises that we can actually do to help with these two symptoms. Now, one of the things that we should get to help to monitor this respiratory system is what we call a pulse oximeter. So I have a pulse oximeter in the picture and also a pulse oximeter. I do not know whether you can see it on the screen here, right? So a pulse oximeter is something that if you can have it, that would be very good. It's actually not very expensive, less than 20, 30 ringgit. You can get it from online shopping, okay? So when I talk about respiratory system symptoms, the normal respiratory rate is about 12 to 16 breaths per minute with no accessory muscles being used. What do you mean by accessory muscles? So if you're breathing You can see that I'm using all the accessory muscles to breathe, right? This 12 to 16 breath is calm breathing, all right? Now, the pulse oximeter should give you a reading, all right, when you put under your finger. So in other words, with a pulse oximeter like this, I put my finger in, I turn on, and I can see the reading in the pulse oximeter. The pulse oximeter should give you a reading of 94 to 98% oxygen saturation, all right? So that is the acceptable level of your oxygenation, all right? And when you have a level of 92% or below, then you may require supplementary oxygen. You can either get it from the tank, oxygen tank, or you can get it from your oxygen concentrator. Now, in some pulse oximeter, you can see that they have what we call PI, which we call it perfusion index. So if you look at some of the pulse oximeter here, you can actually see that there is what we call a PI, right? Now, this perfusion index is defined as the ratio of the pulsatile blood flow to the non-pulsatile static blood. So this perfusion index will help you to know whether your blood flow is good or not. Because sometimes you find that your pulse oximeter may be low because your hands may be cold. And so when your hands is cold, your perfusion index, the blood flow is low. And so your pulse oximeter will give a low reading. So that is actually not a correct reading. So with the perfusion index reading that is present in your pulse oximeter, there's actually no specific so-called normal level, but it is accepted that if your level is 0 to 5, that means to say that your perfusion index, the blood flow is actually low. So if your pulse oximeter perfusion index reading is more than 5, that means to say that it is a good blood flow. And at the same time, you find that your pulse oximeter, you can also see the waveform, right? The waveform is like this, which means that it is normal heart function or irregular. Now, this is not an ECG, okay? So it just, it's not for diagnostic purposes. It's just to tell you roughly whether something is wrong or something is right, but it's not going to tell you much about it. So if you see with a pulse oximeter that your wave doesn't look like this and it looks like this, probably need to see your physician and do something about it, all right? Especially for those who have COVID has affected the heart, then your reading may be like this. Then you need to continue to follow up with the doctor who's taking care of you. All right, so now, when we talk about exertional breathlessness, there is a scale of 0 to 4. Now, I've actually included this scale to help you to know what level of breathlessness, or we call it in medical terms, dyspnea, that you may be having. So this is put up to help you to assess whether you're improving or not with the weeks, all right? So if you have 0, then you do not have trouble breathing unless you put on exertion, right? If you have 1, then you have short of breath when you're hurrying or walking up a slight hill. 2, you walk on a level ground that is exercising with you. 3, you stop breathing for a while after walking for about 100 meters, about 300 feet. Then you take your breath. Then after that, you continue walking. And 4, if you are too breathless to even dress yourself or to leave the house. So that means to say that your lung capacity, your lung function is actually quite bad, all right? So from here, you can actually assess whether you're improving or not with the weeks. Now, there's one term that is called happy hypoxia, all right? So what do you mean by hypoxia, right? It is a state in which your body oxygen level is low. So we said normally it's about 94, 95 to 100% on your pulse oximeter. So anything that is less than 92, we call it hypoxia. And we said earlier that you need to have supplement. A level of 80 to 85 is actually life-threatening, all right? So you probably need to do something about it. The other term that we call happy hypoxia means that a person may be having a low oxygen concentration, but they do not manifest the symptom of breathlessness. All right. So can you see here that without showing any symptoms of hypoxia, without showing any symptoms of difficulty to breathe, exertional dyspnea, and using accessory muscles and so on. So that's why you find that having a pulse oximeter is actually very important to help you to diagnose that you are not having happy hypoxia, right? So your oxygen concentration is low, but you're still very happy. You're not so-called crying for breath or trying to take deep breath. So some of the symptoms of hypoxia can include, this is not an exhaustive list, cough, difficulty to breathe, your heart rate may be fast, you may be having headache, you may have a bluish skin color. So these are some of the signs and symptoms to help you to know that you're having some symptoms of hypoxia. So if you're having breathlessness, what can you do? Some pictures here to tell us what we can actually do, right? These are the symptom relieving position. So lean forward, right? Can you see this person sitting like this on the table or like this? If you are sleeping, then put a few pillows, right? So that you your heart is a bit, your heart and lungs is a bit higher than your legs, all right? And then relax sitting, or if you are standing, lean forward or lean with the back against your wall. So all these symptom relieving position for breathlessness. The other thing that can be helpful in a person who is having dyspnea is what we call diaphragmatic breathing. A lot of times most people actually breathing not using diaphragm, okay? So sit in a comfortable, relaxed, and supported position. Place one hand on the chest while the other hand on the abdomen, and then you breathe slowly through your nose and breathe out through your nose, all right? And with each breath, just feel whether your chest is moving more or your tummy is moving more, okay? So you should find that your hand over your tummy should be rising more than your hand over your chest. Because when you breathe through using the diaphragm, the lung will expand, right? Lung will expand and the diaphragm will go down, causing your tummy to go up. But if you're not using a diaphragm to breathe, shallow breathing, then you'll find that your tummy will not come out so much, right? So you can repeat this about 5 times per set and do this about 5 sets per day. All right. So as you learn to breathe using a diaphragm, then you actually you're able to expand your lung capacity. Okay. So what to do if I am having a cough? Right. You can see here that you can do what we call a pursed lip breathing. All right. So breathe through your nose slowly and breathe out through a pursed lip. Can you see this person breathing out through a pursed lip, just like a purse? And relax during this time. And when you're breathing, you aim at a ratio of inspiration to expiration of 1:2. Okay? And you can repeat this a few times. The other way to look at it is if you find it difficult to breathe at an inspiration to expiration ratio of 1:2, then you find anything that looks like a rectangle like this. So it can be your window pane, it can be your door, it can be anything that looks like this, right? So what you do is we focus on this in here with a relaxed breathing. You breathe in, then after that you breathe out longer. Then you breathe in, then you breathe out longer. Then it will be like this ratio here, okay? So this can help to actually relieve your cough symptom. Another way to do it is what we call the half cough. This half cough is very useful for those who have sputum. like I said earlier, not everyone that have cough has sputum, right, or have phlegm, okay? Because the cough may not necessarily be because you have a phlegm, but it's because of inflammation that has caused your cough reflex to be more hyperactive. So you may be coughing and coughing, but there don't seem to be anything coming out, all right? So when you talk about the half coughing, we're saying that it is a cycle of deep breathing with your thorax expansion, and after that, half with the purpose of clearing up your airway. So can you see that this lady is sitting on a chair? He breathes in, and then after that, he like this, okay? So huffing occurs through a forced expiration and open mouth. So remember that this is different from pursed lip breathing. Pursed lip breathing means we say that you breathe out through a pursed lip. That is to help to relieve your dyspnea, right? But when you talk about coughing, right, you want to cough out, then the huffing will help you, okay? So you repeat it and see how many times you can actually do. Now, for sometimes you find that for some people, either the upper lung or the lower lung may be affected. So if you have part of the infection that affects your lower chest, then you do what we call a small, long huff, right? So small, long huff means that you take a medium breath and then you huff out through your open mouth, like we said just now, right? Small and long, right? Like this, okay? Like this. I think I'm spreading all the COVID virus if you are near me, right? Now, or if it is in the higher part of your lung, right, then you need to take a deep breath and then you huff out quickly, like the first example that I showed just now. So if it is the lower lung, then you take a small huff and huff long period of time, right? Now, there are also some hydrotherapy methods that you can actually do and percussions that you can actually do, which time does not permit. I've already spoken for 48 minutes. So remember, like I said earlier, that your cough may not necessarily be due to phlegm that is in your respiratory tract, but rather it can be a neuroinflammation because of the COVID inflammation cause. So for those who want to know more about how to do the hydrotherapy to help you in getting out the phlegm through doing steam inhalation or doing a hot and cold fomentation to your chest, you can actually go to this website here, right? You can see here, class.anan.my, and there is a recorded session to tell you what are the things that you can actually do, right, if you have a cough. So here are some of the pictures of what you can do if you have phlegm. You can actually Google it and find it, all right? Now, what about some people who have joint and muscle pain, right? So we have come to here, we talk about generalized symptom, we have talked about respiratory symptom. Now we want to talk about joint and muscle. These are not as common as this that we've seen earlier, right? But what can I do if I have joint pain or muscle pain? There are a few things that we can actually do. I've divided it into muscle strengthening exercises. Now, for a person who has been hospitalized for a couple of weeks, you find that your muscle may be wasted. So what you need to do is muscle strengthening exercises. Excuse me, I just take a drink. So one of the things that need to be done, is what we call a biceps curl. So you take a weight, light weight, 1 to 2 pounds, and just flex and extend, right, your arm, okay, on both sides. Or you can do arms raising. I don't know whether you can see me, like a bird that's flapping up in the air. Okay, you light weights. The other things they can do to strengthen other parts of the muscle is wall push off. Okay, you see this person here standing away from the wall, right, flexing and extending. Sit to stand. So a person can be sitting on a chair and standing up, sitting on a chair and standing up, doing it in sets. knee straightening. See this person here straightening the knee, flexing the knee, or squats. Can you see this person here is with the back against the wall and then squatting. Now this may be a little bit more challenging, right? So this exercise may be one that you may need to do, or you may want to do later on when you're more strong. The other one is heel raise, like this. Right? So there are many different muscle strengthening exercises that you can actually do to help to strengthen back your muscles. The next thing is what we call aerobic exercises. That is to tax your heart and your lung. So if you are having a mild illness, then you may need to start with 1 week of low-level stretching and strengthening before targeting the cardiovascular session. So in other words, do the stretching that we have mentioned just now, strengthening of your muscles, then only do something that is going to tax your cardio and your lung, all right? So remember that you need to limit the activity, right? Slowly increase it with rest periods in between, especially if your symptoms become worse. But if your symptoms continue to persist, then you may need to decrease your heart rate, right, beating to not more than 60%, right? You probably can Google and find out how to check your target heart rate, okay? So there is a box scale that helps us to measure how dyspneic we can be when we're exercising, and we try to keep it at a level of 4 out of 10, okay? A level of 4 out of 10. What is this box scale of a level of 4 out of 10? So you can see here that a level of 4 is moderate physical activity. So in other words, you do not want to be severe. So you need to do the physical activity level from here downwards, okay? So, but as you gain strength, then you can continue to increase further on, right, with time. So this box scale is a rough guide to help you to see how intense your physical activity should be. So if you require oxygen, then probably you need to do it even more slower. If you have generalized joint pain and muscle pain, then you probably need to avoid muscle strengthening exercises until the pain in the joint and pain in the muscle actually resolve. All right. So what are some of the aerobic exercises that you can do? A simple one will be marching on the spot. So when you do marching on the spot, it can help to cause your heart rate to beat faster and your lungs will require more oxygen. Or you can do the next step is stepping up and down on one step. So put a box or in your staircase, step up one step and go down, step up one step and go down. That will help to tax your heart and your lung. Or to take short walks around your home and your garden and increase the time, increase the intensity slowly. Now, what are some of the safety things that you need to take note of during the exercise? First of all, you need to have stretching, warm up and cool down. Your clothing should be loose, right? Don't wear very tight clothing that limit your mobility and cause you to be unstable, right? And try not to perform the exercise less than 1 hour after a meal. And make sure that you have adequate amounts of fluid. Remember that take small amounts of fluid many times rather than taking large amount of fluid few times. And if you want to exercise outdoor, make sure that it's not during a hot weather. So these are some of the safety precautions. So when to terminate the muscle strength training? When you feel nausea, when you feel lightheaded, you become more breathless, you have calm arms, you feel chest tightness, more pain, and your heart beat faster than usual. This is a time that these are the symptoms that you need to tell you that you need to stop, right? Balance is something that's very important, okay? And this work balance scale can help you to know, right, how what your level of balance is. You can just Google and find it, right? There's a set of questions that ask you, and you just give your answer, and it will tell you what level you are in. And with that, you will need to see how you can actually increase your balance. Because this is actually very important, because if you do not balance well, then you will fall, and you hurt yourself, and you have broken bones and all. Now, lastly, we want to talk about anxiety and depression. Now, this anxiety and depression can actually occur in people who may not necessarily have been admitted to the ICU with a tracheostomy tube, right? But anxiety is one of the symptoms that occurs in many people. So one of the assessment tools that you can do to see your level of anxiety is do what we call the DAS-21 or DAS-42. Now, DAS basically means depression, anxiety, stress score. So there's 21 questions that you need to answer. If you want a more a complicated one, will be DAS-42. There's 42 questions you need to answer. And when you add up all the points, it will tell you your level of anxiety. Okay. And when you look at this psychological problem, anxiety can come from adjustments, right? Now you have been hospitalized, or you have been at home for quite a period of time, right? You are anxious as to when you can go back to work, right? Whether you are fit to go back to work, and you're trying to hurry yourself so that you'll be fit, rather than to be on MC for a long time, or to be terminated from your work because you're taking too long a time to recover. So all this is stress. Some people have grief and loss, right? In some families, it may not only involve you, but it can involve your loved ones who have lost their lives, or friends who have lost their lives. So that causes grief and loss. Okay, there's 4 stages of grief that a person goes through. The faster you go through the grief process, and the faster will be your recovery. Some people may have post-traumatic stress disorder. Right, you have been admitted to the hospital. There's no beds, nobody attending to you. Some people were still, they are admitted to the ICU. They have a tracheostomy here, and they have a lot of complication, kidney problem, liver problem, and so on. And social stigma is another anxiety problem, right? When you come out from the hospital, you have COVID, and people are thinking, oh, whether you're infectious or not. So all this can actually cause anxiety and stress. But despite of all this, right, there are some of the things that we can do. One of the things that we need to do is to be mindful. All right. Now, notice that mindful is not your mind being full with worries and anxieties and struggles. Mindful means that you are mindful of what's happening around you. You are sitting down and contented and enjoying what you are experiencing. When you chew on your food, you're enjoying the taste of it, right? And mindful is aided with scriptural meditation, right? Some of the scriptural texts that has been helpful to me is, especially when we live in Anan. This is a picture of Anan, right? You can see the mist around early in the morning in most of the days, especially after rain, right? And when I look at the scenery, I can remember what the Bible says in Psalms 121. I lift up my eyes onto the mountain. From where shall my help come from? Yeah, my help comes from Jehovah, who made heaven and earth. He will not suffer your foot to be moved. He that keepeth thee will not slumber. So it tells me that in this process I'm going post-COVID, with all the suffering that I've gone through, there is a God that is keeping me. He is not one that slumbers, right? Behold, he that keepeth Israel, behold, he that keepeth me will not slumber nor sleep, right? And Jehovah is my keeper. He is my shade, right? The sun will not smite me by day, nor the moon by night. It tells me that he will protect me, right? Jehovah, all evil, he will keep your soul. Jehovah will keep thy going out and thy coming in. So this tells me that helps to relieve my anxiety, to tell me that yes, I may have been I'm going through this COVID, post-COVID complication, illness, right? But yet there's a God that's with me, helping me, right? Encouraging me and guiding me. And I have the assurance that I'm going to get better each day, right? Another Bible verse that I want to share is Psalms 40, right? I waited patiently for Jehovah. So sometimes when you are ill, right, post-COVID for up to 12 weeks to 6 months, right? When can I go back to work? When can I go back to be my normal self, right? Just like the psalmist, I waited patiently for the Lord, and he inclined his ear to me, right? He brought me up out of a horrible pit, right? Pit. I've just come out from the ICU, for example. I've been in the ICU for a month, right? Out of a miry clay, he set me upon a rock. There's hope, there's encouragement, right? That God is going to help me out. He gave me a new song, right? So I hope that some of this Bible verse will be an encouragement to you, right? And to help to address the psychological problem, we need to also have psychosocial support, your family members supporting you, your friends, and also to have a non-inflammatory diet. You have been through immunological hypersensitivity response to the virus. So eat a non-inflammatory diet, the one that Candy has mentioned in her talk last week, and do your physical activity slowly, right? For the depression, I will not talk about it here because of the time. I've actually talked about it in the podcast on depression. There's 2 parts of it. Under this apps here in loud voice, you can hear, you can listen to it. And I have said very clearly what you can actually do to help you if you are depressed. Okay, so I will end here. And if there's any questions, feel free to ask.
Thank you, Dr. Lee. We want to thank you actually for the easy guides on post-care COVID that we can practice. Explanations of symptoms that we ourselves can detect that comes with practical health suggestions. For those that missed the early part of the lecture, don't worry, because you can rewatch it again in Facebook and YouTube. We are going to if any of you have questions in Facebook or even in Zoom, do write it down in the comment section. Read it out for Dr. Lee. And for those that want to hear more of Dr. Lee's lectures on lifestyle, you can visit our website on class.anan.my. Again, you can visit our website class.anan.my. We provide few online courses related to health, and there is good news as well for everyone. We are offering a promotion for this month only. What promotion is that? Is if you buy 2 courses, you are entitled to have 10 ringgit voucher that you can use to buy health products from Anan Health Food online. Another news that meant for everyone here is that next week, Thursday, we are having another health talk from another Anan healthcare doctor named Dr. Chiu, and the topic is addictions, the way out. What day will the next talk be? Thursday. What time will it be? Same time as today, 2:30 p.m. So we're gonna check if there's any questions here. Well, we have one question here actually meant for Dr. Lee.
Okay, is the question, what are the food to repair the damaged lung? Is that a question? Laura?
Yes, yes.
All right. Now, remember that when we talk about lung problem, the virus actually causes inflammation in your lung. right? So because of the inflammation, we recognize the fact that your air sacs, the exchange, the area of exchange of oxygenation is impaired. And as a result of that, you find that your saturation of oxygen in the blood becomes less. So what are the things that is actually helpful for a person with damaged lung is try as far as possible to take the food items that is not pro-inflammatory. I think Candy has mentioned it in the last session. The food items that gives you a lot of phytochemicals and antioxidants. So I would like to encourage you to go back to a lecture that will give you a spectrum of all the foods that you can actually take, right? Very briefly saying, it is whole food, right? All the whole food products, all the seeds and nuts, a variety of colors in your vegetables. Remember that vegetables are actually healing, right? Have healing properties, okay? Try to avoid the food that is oily, those have been fried, those have been barbecued, high salt, high sugar intake, because all this will not be the best for your lung.
Thank you. So actually, there's one more question that I missed, Dr. Lee. So the question said, is it okay to experience symptoms after 1 year?
Okay. Generally, you find that for people who have a long COVID, it can actually extend for 6 months or even longer. It all depends on how severe your symptom can be and how severe your illness is. So for some people, the illness, the post-COVID illness can extend to a long time because there is still some inflammatory processes going on in your body. So you need to see your doctor to have yourself being assessed and do some of the assessment that we've mentioned just now to see what the level is. If you are improving with time, then it should be okay.
Okay, seems like we only have 2 questions. It gives us the impression that Dr. Lee has explained to us very clearly that all our questions have been answered. So we want to thank you to Dr. Lee. And just a reminder again, if you guys want to hear another talk on addictions, the way out, do come back again on the same day, Thursday, same time, 2:30 p.m.